Hello, everyone, and welcome to the Arthritis Action Podcast. I'm Mark, as always, your host, and today I'm joined by Mr. Kevin Young. So Kevin is a chartered physiotherapist, traditional acupuncturist, and sports massage therapist with a particular interest in osteoarthritis. And on top of all that, he's also a former trustee for Arthritis Action. So hello, Kevin. Thank you for joining me.
Hi there, Mark. Yeah, no problem at all.
Excellent. Cool. So, today we're here to talk about acupuncture for arthritis. And given my very brief intro of you and everything I know about you, you seem like the right man to navigate us through these waters. So, I suppose let's start. As I said, I've given a brief intro for you, but could you tell us a little bit more about yourself and, your experience with arthritis?
Okay, so yeah, I've been a physiotherapist because I've got my chartership a few years afterwards, but I've been a physio for probably near on 25, 30 years now. So I've been doing that for quite a while, and also trained and qualified as a traditional acupuncturist 24 years ago. So I've had quite a lot of experience now with physio and arthritis, but acupuncture. But my main field, I suppose, was really in sports medicine. I worked in quite a few rugby up to semi-pro teams, and I worked with quite a few professional boxers and mixed martial artists and that sort of type thing. So a lot of my work was from sport, but I always used to have a sort of an army of people used to come in me post-sport where they had the arthritic joints and, they had this going wrong or that going wrong. So I got interested in doing arthritis because basically it's one of their main fields on the after the sports sort of type thing. And then I got involved with Arthritis Action, many, many years ago now. I should imagine it must be probably about 20 years ago, to even be more. So as you said, I was a trustee for quite a period of time. And I was also ran the London clinic up in Harley Street for numerous years sort of thing. And we used to receive members up there for assessments and for treatment as well.
Excellent. I mean, you are. I mean, like, even though you and I didn't get to work together too much while you were a trustee and when I started, you are notorious around these parts in a good way, of course.
It's all true.
Excellent. So I think let's start off really basic for this one. Maybe this may seem too simplistic, but there'll be some who have absolutely no idea about this topic. So what is acupuncture?
Well, obviously, as most people will know, acupuncture comes from the Chinese. I reckon that acupuncture they say between 2,000 and 3,000 years, but now they're starting to bring out dig up scriptures, which are going back as far as 5,000 years. So they're actually saying that they think it's been around for a lot longer than we actually documented it or think it's been around. And to put it in real basic terms, what it is the insertion of very fine needles. And I mean very fine in the sense of that, a needle is 0.25 of a millimetre. So it's a quarter of a millimetre thick, which is very, very thin. Obviously, it could be as thin as a hair, really, sort of thing. Okay. The needles are made of stainless steel. Okay, and they're one use only sort of thing, so you don't use and reuse them again. And basically what you do is you put needles in and around joints or into muscles in and around the body or around the joints where you want to have an influence on. Now with acupuncture, obviously, when the Chinese, they used to look a lot more about the energetic level of the body and the energetic level of using acupuncture. So quite often what they would say is that a lot of the problems we have with our pain and injuries and that sort of stuff is normally caused by a stagnation of the energy and the blood in an area. So the idea is what you do is you put in specific needles in channels, which run up and down the body, to basically to release the stagnation and to help the blood flow into that area better sort of thing. So quite often, I'll say there'll be stagnation where it's all jammed up, but also quite often it might be there's a lack of blood in that area sort of thing. So it's to help encourage blood into that blood. Okay, so yeah, the Chinese have been masters of it for many, many years, but it don't stop in China because quite a lot of the other Orient out there, sort of, Taiwan and Korea and Japanese, they all have their own versions of acupuncture and what you call Chinese medicine.
Okay, so one thing I was wondering about that is like a lot of this, these days, a lot of things are kind of more needed to be based in science. But when you talk about, say, like the flow of energy through the body, how do you then sort of like justify that with like a modern scientific need for explanation of that?
Yeah, that's going to be quite hard because I could really get technical and get quite into research-based stuff. But I try and keep it a little bit light-hearted so that people know and try and understand. But it's all about interpretation. So the energy of the body, we know in Western medicine, is basically the electrical impulses which run around your body. And it's just getting interpretation. We would say from the Western world, it's electrical impulses which run up and down the body. The Chinese would say that's the energy of the body. Okay, so that's how that's in theory that's what they say about the energy. Obviously, blood is no different. So they would talk about might be a deficiency of blood in a certain area. So it's not lubricating the joints, it's not lubricating the muscles. So by using certain needles in specific areas, it'll encourage that blood flow into that area, so it comes more freely. And obviously, by doing that, it makes it more stronger and more better sort of standard of muscle and joint.
Great answer. Great answer. That was very good. Thank you.
But I can
Yeah.
truth you, Mark, I could have gone in a lot more deeper and you'd have probably been lost. But the physiological stuff, I mean, I just quite recently researched quite a lot of it for a lecture I teach at a Chinese medicine college. And it's actually, there's quite a lot of research backing up what the Chinese have been saying for many, many years from a Western point of view. So, but they say maybe that's another day, another podcast.
Oh yeah, no, absolutely. I would love to learn about that. It's something that's always fascinated me about. Like, so I think some say when it comes to Western medicine, when as soon as you heard the word qi or ki or something like that coming along, then immediately their ears closed and they don't want to hear it anymore. But as you say, it's just about perspective and what you're calling different things. The result's the same.
Yeah, no, definitely. And I always say because obviously I went into traditional acupuncture and Chinese medicine as a fully qualified physiotherapist, sports massage therapist, a sports therapist. You know what I mean? So I've come from a very Western therapeutic world sort of thing, and then to go into Chinese medicine and having all these different things sort of aimed at me and talked to me about, and I'm thinking, what's that? That's not what we do, sort of thing. But in actual fact, when you more and more you get into the subject, or obviously my course in traditional acupuncture was 3 years long. It's a degree course. So all of a sudden I started realizing actually it's not necessarily about that they're talking about a different thing to what we're talking about. We all talk the same. It's just a different language. It's just a different interpretation of what you're talking about, basically.
Excellent. So, what I was going to ask you, like, what are like the different types of it? Because I know, like, say, there's often a distinction between, say, like, sort of traditional Chinese acupuncture and Western acupuncture. Is there really a difference? I mean, it sounds like you're saying that there isn't really. It's just more about like what they're labeling it as.
Yeah, you could argue that you get a group of people which are what you call the traditional acupuncturists, and they've obviously practiced or studied Chinese medicine, normally for about 3 years. It's normally a 3-year course. And in that, they'll learn acupuncture, but they may learn, other things like herbal medicine. They may learn Tui Na, which is Chinese massage. They may learn Qigong, which is a breathing type exercise, movement exercise like Tai Chi. So that's your sort of one side of the acupuncture field. But then you've got what we call your Western acupuncture. So I teach a physiotherapist acupuncture. So they get not very long, but a 3-4 weekend course in acupuncture. But you've got to bear in mind that physio's already done a 3-year degree course in anatomy, physiology, and all the other bits of things. So they know what they're doing. It's just a matter of showing them how to place needles, where you would place them. Now, again, some, or like the acupuncture physio course, which I teach on, we use the same meridians, channels up and down the body, and we use the same acupuncture points, the same what the Chinese would use, okay, but just not so many of them, okay. There is other forms of acupuncture. You've got what they call dry needling, which is basically just needling into soft tissue, muscle, whatever sort of thing, where they want to try and release the muscle because it's tightened up, or if they want to encourage, again, blood flow to an area because I don't think there's enough blood and energy in that, or in that area, sort of thing. So that's normally what we call Western acupuncture, or you could even start calling it trigger point acupuncture, where this is another subject which is more Western, about trigger points all along the body, which gets tightness and adhesions of muscles in certain areas. So they will use an acupuncture needle, go into that area and try and release that adhesion, that stickiness, that tightness in them. But in theory, I always say, if you're sticking a needle in someone, it's acupuncture. Whatever way you look at it, whether it's dry needling, whether it's trigger point theory, or it's whatever, you're still using acupuncture. The only difference is more when the dry needlers or the trigger point therapies, they don't tend to use specific acupuncture points. They don't get taught that. They don't get taught the channels which run up and down the body. Okay, so that's probably where the difference is. And of course, not to be disrespectful, but an acupuncture sort of like trigger point course or a dry needling course, you could probably go for a weekend course, which is not obviously long enough. But there you go. So it's about education, I suppose, really, something on a lot of the courses.
Okay, great. So I guess the next logical question for them for all this is, how does acupuncture help with arthritis?
Okay, so now, obviously, because I come from a Chinese training, I would look at other theories in Chinese medicine, sort of thing, about how we can treat and help with acupuncture sort of thing. So they will look at different things, about, again, like I said, deficiency of energy and or blood in areas. They would look at, the fluid of the body and all that sort of type stuff. They'll also look at degeneration and how that operates and everything else. Now, I will probably say that I always tell my patients quite clearly, you're not going to cure any arthritis with acupuncture. That's not what it's about. What it's about in using acupuncture is using it a little bit more subtly than the hard, strong techniques which you could use in massage and manipulations, that sort of stuff, to treat a joint or to treat the area where you're getting pain. So that's when we then go on to more into, you're probably doing a lot more pain relief, with a joint sort of thing. But I know, obviously, my 24 years of experience of doing acupuncture, that when you're using needles around joints, it helps releasing that joint and allowing it to get a bit more mobility and movability, I suppose. So that will then, in turn, help the patient become more active and actually do the things they need to do, which at the end of the day is exercise.
Definitely, completely agree. Yeah. So, I mean, talk us through like a typical appointment for someone. If someone's coming in with arthritis and they come to do some acupuncture, what would that look like for them?
Well, it depends on who's doing. So, sometimes I will do completely Chinese mode, and what I mean by that is because we ask different questions, when we're treating people. So we will ask questions, a lot of them. We call them the 10 questions in Chinese medicine sort of things. We'll ask things about, their sleep patterns, their bowel movements. We talk about their digestion. We talk about the sleeping, the energy, how they feel, and that sort of stuff, sort of thing, to try and get a bigger picture of their body. And that's why they always say with acupuncture, you're treating holistically, you're treating the whole body rather than just treating a joint or treating arthritis or treating whatever sort of thing. So normally, most patients come in, and I will add in some of my Chinese medicine, but I will still do what I call the box standard orthopedic medicine examination. So I'll test the joint exactly the same way as I'd normally do for any of my patients. Okay, so if they're coming in with a bad knee, I'll do all my normal tests to check, see what's going on with the knee. And then I'll ask a lot more questions about their general health. I'll ask them about things like, what they can do and what they can't do, what is their mobility like. And then from there, I'll build up, again, this picture of what they can do, what they can't do, and then try and counteract that with using acupuncture for pain and to help with their mobility, and then encourage them on to do exercise.
How many treatments do people have to go through then to get some benefit from it?
I will say, whenever I have a conversation with any patient about acupuncture, I always say you need to have at least 3 treatments on a weekly basis to see if it's going to make any difference. Because the thing is with acupuncture, it doesn't suit everybody. Not everybody. Some people respond really, really well, and some people respond quickly. Like the first treatment, they'll say, "Oh my God, I've had these miraculous changes since my body since that first treatment." But some others, it doesn't. It takes a couple of 3 treatments to do, to get it working. But I normally say, as a guide, 3 to 4 treatments. If it's made no difference between 3 and 4 treatments, and in my opinion, it's not going to work, and we need to look at a different way of doing things. But if they say to me, "Oh, Kevin, actually, after the first, second treatment, I could see the difference," then the normal treatment protocol would normally last for about 6 treatments on a regular basis, on a weekly basis, if you can. But obviously, we've got to take in consideration, charges and money and everything else, sort of thing, and see what the patient can afford to do. But we can always work with patients, sort of thing. So normally 3 or 4 treatments to see if it's going to work. Then if it is working, we'll go up to about 6 or 7 treatments, and then we try and keep an eye on them for every month for a couple of months, sort of thing. Make sure that it's carrying on the treatment, carrying on the therapeutic part, so they're not going backwards, they're going forwards with it, all sort of thing. And then it's up to them. If they wish to come and have some treatment on a regular basis, sort of thing, because they believe it helps them move and keep them free and easy, then that's what we'll offer them, sort of thing. But normally, I would say, if you would ask me for a number, I would say 6 to 10, and then you were pretty much on your way.
One thing I've heard, which is it sort of touches on something you said in there, where I remember, so this is something I've had as well, and I've had a lot of people from our online groups who've said the same thing. So I remember about 15, more than that now, but I'm older than I think I am, I think. But about around then, I prolapsed some discs in my back and had acupuncture for the first time. And it was absolutely brilliant the first time I had it. I felt such a relief in like all the muscles in my glutes and my lower back, because they were in a terrible state when I practically crawled in and I walked out. So big difference there. But then I remember, as I had sort of subsequent treatments after that, I found much less of a result after that. And that's something I've heard from a lot of other people. Is that quite common, or is it just...
Yeah, it is. And normally I always say to patients, you've got to, it's never the same. Everybody's different, But yeah, people like yourself, sort of thing, they come into that first treatment And they say that this first treatment was almost like amazing sort of thing. It just
Mm.
released everything, and I just felt like I was $1 million sort of thing, and I was okay, and I was cured, and I was this and I was that. And then the second treatment, they said, oh, well, yeah, it was okay, but it wasn't like the first one.
Yeah, that's exactly kind of how mine was. Yeah.
And I always say that normally, when especially if you've not had acupuncture before, that first treatment, in my opinion, from a Chinese point of view, is you release so much energy and stagnation. That's what you're feeling. You're feeling that release of the muscle groups in their area, sort of type thing, and that's what it does. Sort of, whereas this next couple of treatments, sort of thing, they might not be so releasing because they don't need to, because you've done what you needed to do on the first couple of treatments. So yeah, I always say that the first couple of treatments normally are very, very strong and very, very, changeable in the sense of that, different things happen to people and much more positive. But the one other thing I would say sort of thing is that also that it's don't start feeling, oh, that's it, I'm not going to do no more because it doesn't work.
Mm.
You need to have that sort of regular, consistent treatment for about 6 weeks to have the longer lasting effect.
I think that goes for like, a lot of manual treatments as well, doesn't it? I think people just go once and then think, oh, well, that's that. Then I'm solved for life. Whereas there's so much more like maintenance and extra things that can be done because it's just like kind of the start of a treatment journey, isn't it?
Yeah. And I mean, obviously, as I said, I am a physio as well. So in the back of my mind is that I know when this patient comes in with arthritis, if they're not doing any exercise or movement, I've got to get them doing that. That's part of what a physiotherapist does.
Mm.
So by using the treatment, that will help release them, get them feeling a little bit better. And they think, oh, do you know what? I really do believe I could do some exercises now, sort of thing. And then just lead them into the right type of exercise for what they want and what they need. I mean, because obviously different bodies, different types, different ages, So, but yeah, I think it works really, really well in a combination of other things, sort of thing.
I do think that's a point to reiterate as well, because I mean, you and I were chatting earlier on about this, but it was off air, so I'll reiterate it on air. The thing, like we said, when you get something like a manual treatment, or whether it be acupuncture or any other type, it then allows you to do things like your exercises, which are so important when you have arthritis. And I'm sure everyone who listens to this on a regular basis is really bored of me banging on about this all the time.
Yeah,
But the reason I
yeah.
bang on about it all the time is because it's so important.
A typical example, I suppose, is myself. I mean, over Christmas, just before Christmas, I had a little bit of a mishap with some deadlifting, very light, but I say it did affect my back. Now, I did have a scan on my back, and it wasn't very good because I had prolapse all over the place. But they're not new prolapses; they're probably old ones from years of, because I did play a lot of sport and a lot of power sports sort of thing in my time, sort of thing. So I should imagine that's probably where they will come from. But I had a massive flare up over Christmas. Now, of course, I'm lucky because my partner is a traditional acupuncturist.
Oh, great.
And I'll go and see a McTimoney chiropractor as well, fairly regular sort of thing, just to keep me straight and everything else. So over that period, I was having quite a bit of treatment. My partner was doing a treatment every week for about 6 to 8 weeks. And then I was getting a bit of chiro treatment, sort of the McTimoney chiropractic treatment. And that worked really, really well because it's a lot more softer type of chiropractic medicine than the normal one. But then after about sort of 6, 7 weeks, my partner said, well, do you want a treatment? I said, no. And she said, what? And I said, because you've done what you needed to do now with that treatment. I need to now get back and doing those exercises and making sure that I can still function. And that's where it's going to come down. So, and that's exactly what I did. Now, I still get a treatment here and there sort of type thing when I'm feeling a bit tight and everything else sort of thing. But I've got to be true for you. The long-term medicine is doing the exercises, is doing the strengthening again and doing the bits. And I'm back doing my 2 kettlebell workouts a week. I didn't have a very long break from doing that. I used to do Wing Chun Kung Fu, but I've had to can that because there's a lot of twisting, which did affect my lower back. So I'm now doing Tai Chi, which I've been doing that now for about 6 months, and I find it really, really effective on backs. Okay. And I still try to do my sort of, I always say 7,000 to 10,000 steps per day, and I've now managed to get back. Is my back cured? No, of course it's not. But it's now at a level where it's not flared up, it's calmed down, and I'm functioning and I'm doing my exercises to keep it strong, keep it mobile. And that's what it is. So I'm a little bit sickly, I'm afraid. I do practice what I preach. As a physio, I do stretch every morning. Every morning when I'm washing my teeth, I'm stretching, and I also do a Tai Chi session once a week. Should do that a little bit more because you're meant to do that every day sort of thing, and I will progress to doing that.
Well, you're a man after my own heart. I'm also riddled with injuries from too many rough sports, and love my kettlebells, martial arts, and yoga is one of the big ones for me. I'm a big fan of doing that. Found that's done wonders for my back.
Yeah, no, definitely. The thing is, I always say it's what suits you. And I did try yoga a couple of times, but I don't know, it just wasn't me in the sense of that, maybe if I had a good instructor and said, oh, yeah, but you've got to do it for a year and then you'll get the benefits of it sort of thing. But the funny thing is that when I went back to Tai Chi, doing Tai Chi, almost immediately I could feel it. And I always feel that it's like in when we do Tai Chi and Qigong exercises. I was never good at doing them sort of standing still Qigong exercises where you stand like, they call it stand like a tree. You just stand there with your arms in front sort of thing. I was never ever good at any of that. But I was good when we actually did Qigong where you're actually doing movements and that sort of type stuff. So that's why I think with Tai Chi, because I'm moving all the time, that suits my body and my personality, I suppose, sort of thing. I'm a very, I like them to keep moving, sort of thing.
Yeah, I think you hit upon a very important thing with exercise in general. There is you've just got to find the one that works for you, because not the same type of thing will work for everyone. But there are lots of things that give the same effect. So find the one of those that works for you, and
Yeah,
whichever benefits you is the right one, really.
yeah. And we'll probably talk about this a little bit more later on. I mean, the patient's got to find their exercise and they've got to make that first step. It's like on anything. They're always very nervous about doing it, but just ease yourself into doing something. And we now actually in physiotherapy stop using the word exercises. We talk about being mobility or movement.
No, I use activity myself because people are
Yeah,
scared of the word exercise.
well, exactly. So and if you turn and say, I'm not asking you to go to the gym 6 days a week, but I am asking you 6 days a week is to move, is to do things, and that's a lot more acceptable, to patients, and understand what they've got to do, sort of thing.
Definitely. So speaking of patients being nervous, actually, this is a silly question, but I know one that does come up loads of times, or at least people will wonder it. Like, does acupuncture hurt?
I'll be lying if I said you can't feel it, okay? But I don't think it hurts as such. It is literally like a very fine pinprick. So you do feel that, and then with acupuncture, what we do is we insert the needle and we locate it to our depth, and then we do this twiddling on it to try and sensitize it, so get the chi, we call it, or get the energy working, something. So, and all of a sudden the patient say, "Oh yeah, I can feel that," and they leave it. Okay, so. But once the needles are in, it doesn't really hurt, sort of thing. You don't really feel the needles in as such, sort of thing, unless, like me, I attach little electrode to it, and we've got a very fine, like a TENS machine, sort of thing. So we pulsate some of the needles when we need to have a little bit more active movement in that area, sort of type thing. So, but yeah, I'm not going to say, as I said, I'm not going to say it doesn't hurt, but I don't like to call it hurt because I don't think it's like a pain, but you feel a sensation, and that sensation can be so different for different people. Some people say they feel like not much yourself, a little bit of an achiness or a deep achiness. Some people first say they feel like a little bit of almost like a little mild electrical shock movement sort of type thing, or some people just say they just feel a little bit of a pain and it goes, sort of thing, So everybody's different in how they feel, how they perceive that sensation. But I would say more of a pain, it's more of a sensation you feel.
Yeah, I think I'd agree there from my experience as well. One thing I would like to explain, actually, if you can, is you mentioned me like the sort of like the twizzling them around and stuff. Can you explain that a little bit more? Because I think that's always a little surprising to some. Like when there's needle in there, and it's almost like you give it a little twist or a little move around. Yeah, so can you explain that a bit more?
From a Chinese point of view, from Chinese medicine, they will say that what you're doing is they call it de qi. So to get de qi, you have to basically drill into the energy stagnation or whatever sort of thing. And they say when you get that little kick, that little sensation, that's because you've got de qi, which is getting into the energy. Okay, so that's what they say you're doing. Now, from a Western point of view, they will say that what you're doing there is that you're locating very fine sensory nerve endings, okay? And that's what you're stimulating. You're stimulating those nerve endings. So don't get me wrong. I want people thinking, oh my God, it's going to be, it's going to be stimulating my nerves and it's going to hurt and it's going to do this, it's going to damage it. No, it's not that. You're talking about you're stimulating the very fine little ends of the nerve sort of thing, very fine parts of it sort of thing. And you're not actually attacking them. What you're doing is just stimulating the area around it. And of course, the idea of the nerves is they feel that. They can feel when it's working or when there's a sensation happening sort of thing.
Okay, that's a good explanation. Thank you. So here's another one for you. This one might be a little bit complicated, so answer this the best you can. So does it work for all types of arthritis? Because there's so much nuance within different types of arthritis. Like, is there a difference for how you would do it for osteo to rheumatoid to psoriatic and so on?
Yeah, there is. And the thing is, when it's basically osteoarthritis, so when you can actually say, right, it's this joint, that joint, here, there, then you can treat that joint, okay, and then in a certain way. But when it comes to things like more the inflammatory type of arthritis, so your psoriatic arthritis, your rheumatoid arthritis, your inflammatory arthritis, from a Chinese medicine point of view, we tend not to actually treat the joints themselves. we treat the whole body. So we go to certain acupuncture points which we know, and they've been researched in actually they calm down pain. So they work as almost like a pain relief. They calm the body down. They de-stress you. They make you feel nice and easy. So when you've got the inflammatory type of arthritis, we tend to use those points. We treat more body acupuncture. So we treat the whole body rather than treating a joint when we're dealing with our osteoarthritis. If that makes sense. So yes, there is a little bit of difference. And even from a Western point of view, if you've got a physio who's doing it, what they will tend to do is if you turn and say, look, I've got rheumatoid arthritis, how are you going to treat it? And they'll probably turn and say, yeah, I'm going to use just half a dozen pain points on your body, which we know calms the energy and calms the pain. It desensitizes the body.
Okay. Tell us a little bit more about like what effect acupuncture can have on pain in general then.
Well, and this is where it starts going into research, because you can look up acupuncture for pain, and there's a hell of a lot of research. And I think this might be a good time to talk a little bit about the research, because
yeah, please.
People try and say that the problem being with acupuncture, there's no research. Well, what I can tell you is that, and obviously not this exact year because we haven't looked at the stats yet, but 2 or 3 years ago, the most researched subject in the world is nursing, apparently, which I didn't know, sort of thing, right? But the second most research subject is acupuncture. That's
really?
So they say that when people try and say, oh, there's no research in acupuncture, well, actually there is, because it's the second most researched subject in the world. Okay. And yeah, like everything, it's not all positive research in the sense of that it's done well or the results are good. But there's a lot of research which does actually tell you about how good it is and what it does. And there's a lot of research in there in explaining what you're achieving when you stick a needle in someone physiologically in your body from a Western point of view. Okay, so when people try to say, oh, acupuncture doesn't work, there's no research, well, that's actually wrong, because there is research to actually state when I stick a needle in your arm, what is the physiological reaction, the chemical reaction, and the brain reaction to having that needle stuck in that arm. And then you can actually document what it is there, sort of thing. So there is quite a lot of research on it. And of course, I've been talking away here now, and I've forgotten what the original question was. There you go.
About its effect on pain.
Yeah. So a lot of those research points, which have been done over years, a lot of them have been done on pain. So in physio, we're only allowed to treat certain things with acupuncture, and they tend to be more the joints and the pain type aspects, sort of thing. So we still treat chronic pain because the research has backed it up to say actually acupuncture works really, really well on chronic pain. Okay. They also say that it works on really well on arthritic pain. So, with knees or back or things like that sort of thing. So, yeah, it is really, really good for treating arthritis.
What should a patient be telling you when they go in for a treatment? Is there anything that would kind of help the treatment be a bit more successful? If there's certain information they should be passing on to you?
Yeah, obviously it's down to the practitioner what they're going to ask you, because when you go for acupuncture, depends on who you're going to see. You may go and see a traditional acupuncturist who will have a whole new line of questioning, sort of thing. As I said, the 10 questions where we ask some a little bit, not diverse, but sort of subjects a little bit away from actually what they're coming in for is their arthritic knee. Okay, but that's the way they do it in the sense that they like to paint this picture. But we always fill out the first page on the thing, when you put in all the personal information, things like, the name, their address, the doctor's surgeries, who they are. And then we'll ask for any previous medical history. We'll ask for any medication. We'll ask for any allergies, things like that. So we can see if they can be suitable for acupuncture or not. So it's just like going to see a normal physio or a normal osteopath or a masseur. The questions they would ask you about your body is what you offer up. And if you feel there's some information which they haven't asked you, which you think is relevant, then just ask them, just tell them.
Okay. What about other conditions as well? Because obviously lots of people with arthritis will also have other conditions as well. And what's the suitability of acupuncture to other conditions?
Yeah, and obviously, one of the things I'd say is you've got to be careful what we say we're treating and what we're not treating and everything else sort of type things. At the end of the day, we're not curing these conditions sort of thing. We're helping, maintain maybe the side effects, maybe the signs and symptoms that you're getting. So that's what we're trying to help with, sort of thing. So yes, if you go and see a traditional Chinese acupuncturist, okay, who's done a full 3-year degree course in acupuncture, Chinese acupuncture, they can actually treat other things. So I quite often will treat just off the cuff ladies with menopausal symptoms. I get quite a lot. It's quite a little bit of a joke in when I teach something, because all the students turn and say to me, "Oh, all you ever treat is musculoskeletal and pain and injuries and sports people." I say, "Yes, that's true," but I said I have this harem of menopausal women which seem to come to me for a treatment sort of thing, because it's been very, very effective for treating menopausal symptoms.
Doesn't.
I also treat other things. People who might be having trouble with irritable bowel, so IBS. Now, again, I'm not going to cure that IBS, but using needles and using acupuncture, you could have a really good therapeutic effect on their bowels and actually just calm it all down and make them feel a lot more better and be able to maintain and manage it a lot more better. I've got a lady coming in at the moment who's got Crohn's. Okay, so I'm not directly treating her Crohn's. What I'm treating her for is what signs and symptoms or what side effects she gets from having Crohn's. And again, we've been really, really successful in what we've been treating, sort of thing. So yeah, the answer to your question, I suppose, I do treat lots of other conditions in my traditional Chinese acupuncture life, but obviously from a physio point of view, then it's just normally pain, joints, and injuries.
Okay. Last question now then. So what advice would you give to people thinking about trying acupuncture?
So I would just say to patients is, or members, if you've never had it be done before, go and try it. Just go there with an open mind and just sort of say, right, I'm going to come in and see you. I'm going to do 3 or 4 treatments and see what sort of difference and what effects it has on my body.
Definitely. Yeah, keeping an open mind, I think, is definitely one of the best bits of advice you can give to anyone, I think.
Yeah. The funny thing is when I ran a clinic up in London, obviously most of the people came there in the impression that they were going to get physiotherapy and sports massage and that sort of type therapy. And they did. But if I talked to them, and when I did my questionnaire, because when I used to question we used to have a nice hour-long first appointment sort of thing. So it gave me time to go into some of the Chinese medicine questions, which I'd like to ask them sort of thing, because that gives me some more information about their body and what's happening with them sort of thing. And it may be that I might try and say, look, do you know what? Why don't we do the massage, we do the advice on exercise and movement and everything else, and why don't we do some acupuncture and just see if we can help that? And the funny thing is what a lot of patients I had there were having acupuncture.
From my first-hand experience, it has done me very well. I know lots of people who it has done. So yeah, if anyone wants to try it, absolutely do. And if you are a member of Arthritis Action as well, because you're one of our associated practitioners, we have an associated practitioner service where basically we will subsidize some money towards 2 appointments per year. And yeah, then you can go and see one of our network of sort of physios and osteos. So if you want to try acupuncture, that'll probably be a nice, easy way to do if you're a member. I mean, if you're in the right area, you could even go and see Kevin himself.
Yeah, no, definitely.
Excellent. So if anyone would like any more information on all the stuff that we've talked about today, please do visit our website. We've got loads of resources, fact sheets, loads of information about this on there, and you can find the link for that in the episode description below. There's also an email address there, so if you do want to contact us with any comments, suggestions, or anything at all, please do contact us via that. That's also in the description. And please don't forget to follow, subscribe, share, get the podcast out there as much as you can so other people can enjoy this as much as you hopefully do. And then set up your alerts as well so you never miss an episode. And great. So we'll end it there. And thank you so much, Kevin, for joining me today. I really appreciate it.
No, it's my pleasure, mate. Anytime.
And thank you, everyone, for listening. Bye-bye, everyone.